My name is Dr. Scott Peterson. I'm a licensed marriage and family therapist. I'm also a licensed independent addictions counselor. What made me want to become a therapist, I started working early on in behavioral health in my psychology undergraduate degree. I was working in a group home with young teenagers, and I would see these teenagers really trying to get through life. They weren't with their parents. They were coming out of foster care, coming out of juvenile situations or behavioral health situations. And we were more or less kind of containing the behavior, but when I really saw change is when they were able to get visits with their family members or with others. Suddenly their behavior would change, sometimes for the good, sometimes not for the good. And at that point I realized there's more to this than just talking to an individual or dealing with an individual. You've got to deal with the system. So that's how I got into marriage and family therapy, is really understanding that parents and kids, they all impact each other, for good and for not so good sometimes. But that's the biggest source of change I see, is seeing things from a systemic perspective. The areas of therapy I love specializing in are working with adults, particularly with couples. I really love working with couples, helping them to find that reconnection, find that peace that they're hoping for, they may have had in the past that they've lost. So helping them to get unstuck is really a passion of mine. I've been a therapist for about 25 years. A number of those years I've also been a clinical supervisor. So I've helped train other therapists who are working towards their work with patients. So my process when I meet with a couple and they come in is I want to understand how long they've been together. How did they get together? Where in the relationship are things going well, and where did things get off track? Because if they're coming in to see me, things have gotten off track. I want them to really understand that they're going to walk away with something that they can do. I really feel like if a couple comes in for therapy, it should be more than a conversation, they leave and they don't know what to do. So I really want to make sure that they've got a specific task or a specific thing that will help improve their relationship. And each step of the sessions that go is building upon the things that we did before.